So Steve, Louise and Charlotte have already had the TRIOS scanner and they were using it for a long time.
I'd never used a scanner before. It's made my life so easy. I don't even think I would ever do an impression again, considering how I hold my breath every time I used to take an impression just to look for any bubbles.
Integrating the TRIOS into the practice has been pretty seamless, really. Having the tech, having the, impressing the patients, the fact that we don't have to have any impression material anymore. I haven't used impression material for I don't know how long.
Adopting the TRIOS scanner was always something I was very wary of, but I took up the courage and one day just decided to use it, and with Charlotte's help we sort of went through one patient, and then I realized how easy it was to navigate through the TRIOS software, and patients loved it. It was easy. They weren't having to put up with any impression taking. Gagging reflexes were easy to manage.
It gives us a bit of a buzz. It's something fun to sort of look forward to do. Patients engage and interact with the scanning technology. It's really been an amazing sort of bonus for us. We've been using the TRIOS scanners for probably 5 or 6 years now. It's been great.
Because it was so easy, it was just, made the workflow really sort of fluent and easy to use.
I think once the other practitioners saw how well it sort of worked for me, and patients sort of accepted it, I think getting them on board was really straightforward. It wasn't a hard sell to the other practitioners in the place. It was great. It works well and it's engaging and fun to use.
I've been practicing for about 30 years now and have been seeing patients from a wide age range. Having to put up with initially all the messy impression-taking materials, the gag reflexes of patients, and all of a sudden you have something that's not messy, easy to use.
I used to use Steve's scanner intermittently whenever it was free, but I found that quite frustrating, and I find it would help patient acceptance when you're available and you're able to scan the patient then and there. So I decided, and I'm an associate, so I bought my own scanner, and now whenever a patient inquires about a treatment, I can scan them on the spot. So I think the treatment uptake is also a lot better because of that.
So I think for me, it was a game changer, and it's the best thing that I've integrated into my practice. It doesn't take a very long time. It's, within a few minutes, you have the bite registrations, the up and lower scans done very easily, and also just emailing the lab technicians. It's just easy. Everything's done online. There's no lab slips, no postage of impressions that you have to do. For me, just time saving is a big thing, and just being able to pick up the scanner, and even just for patient monitoring, just using that straight away. I don't have to book a specific time for it. Just the workflow is a lot easier.
The benefit from having multiple units in the clinics, just that we don't have to worry about, sort of making sure that we're going to have any crossover. So we've got sort of clinical independence from each other. It's been something that's worked really well for us. It's not affected our productivity in any way. We don't have to worry about if someone's going to be using it. We don't have any time constraints. So that's been a real bonus for us.
Knowing that I've just got the availability to use it. People will randomly come in and ask for a mouth guard for their child. I use it for splints. I use it for retainers. I can just use it for anything. I feel like aligners couldn't be done without scanners nowadays. It just makes it so much easier in that it's sent on the day to the lab, and I can basically receive the treatment plan the next day. I do use it for patient monitoring as well when they grind their teeth, so I can monitor between appointments to see how much wear has actually occurred. And I also use it for treatment simulation because I find the patients like to see how their teeth are going to look. So the TRIOS, I can actually visualize and show the patient how things look. So I think the benefit of having multiple scanners is that you don't have to wait, especially when a clinician is running late, because we always know that happens. Things don't always go to plan. So I can just have it there, ready to go, and not have to wait and, make my day run late as well. The patients love the technology. They're amazed every time I bring out the scanner. They just think it's so amazing how far dentistry has come and that we have this sort of technology. So being on the TRIOS care plan has given me the security to know that if my scanner doesn't work and I've turned it on and off multiple times, that someone can help me straight away and get that connected again, because it can be very frustrating, you know, if you've got no help and it'll throw out your day unless you had that support person.
We've utilised the TRIOS care service plan in terms of sort of updates for the support's been really good. We've done a couple of courses here and there, so that's worked well for us. So it's sort of just something that was pretty much a no-brainer really to jump on board with that.
The TRIOS scanner service plan is very helpful and useful to us. We were able to attend workshops that were specifically tailored, the ability for us to use, and any questions that we had were answered at the workshops. There was very hands-on, sort of practical information that we were able to gain from that. I've also had the chance of having a one-to-one virtual session with one of the TRIOS representatives.
I've attended a couple of the workshops. I sort of intend to go to a couple more. There's a lot of material inside the program, and especially even now with the sort of the new updates that we can sort of utilise, and probably underutilising a bit to a certain extent. So just getting to get the full value out of the products, what we're aiming to achieve.
And I had very specific questions related just for my workflow and what I was interested in, and that really helped. Rather than just having a general overview, it was very specific, tailored to what I wanted to know. It was just to be able to improve our work skill.
I've had to ask for support a few times just when updates haven't occurred, because I'm terrible at updating software. So I would reach out to my support member and she would fix it within a matter of minutes. She's really great for that.
The benefit it's sort of given us is just peace of mind, I think, as much as anything. We know that if we have any problems, we can jump on the phone straight away and get support. It's meant that our questions are answered quickly. Having it as a backup just makes the experience really easy and seamless.
The other thing is it was just good to sort of be peace of mind that we have a 5-year warranty to that, and just even the software updates that come through quite regular, that we know that the scanner is working beautifully and all the time.
In terms of warranty, we've had a couple of times that we've had to sort of utilise it. For one reason or another, there was a problem with the scanner that I had, and we were able to sort of switch over scanners. But it meant that we haven't had any downtime, which has been really good. And the support we've had has been great.
I find technology very scary and challenging, and that's why it took me a long time to actually adopt the TRIOS scanner. But when I did, I think just finding it how easy it is to maneuver through the software, that was excellent for me. It was a game changer for my workflow and in the surgery.
I would say to someone, it may seem that it is a big investment, and especially for me as a dentist who doesn't own a practice, but I think that money I invested paid off because of the availability and how much more treatment I could provide to my patients.
From a cost saving, time saving, it's fun, it's interesting to do, it's great. It's a no-brainer really.
It's easy to use, and I will never look back. Even with patients, they are very appreciative of the new technology that we have in the surgery. It's easy for them to also, they don't have to deal with all the impressions, so they are very impressed when they see the scanner, just the virtual look of their mouth, where they can see what's happening. It's a good sort of communication tool for the patient if we want to have a chat about any aesthetic work as well. So it's been a really good technology adopting that for me.
So the TRIOS definitely makes the appointments shorter, because compared to general impression taking, I would normally pour up my impressions also, and then you have that wait time for the plaster to set, whereas I don't have to wait with my TRIOS scanner. It's just done instantly.
Well, in the practice, we have 4 scanners in total. We're 5 practitioners, and having each our own scanner just means our workflow is a lot easier. We don't have to shuffle around waiting for a scanner. We don't have to specifically book patients in only when the scanner is available. When the patient's there and we need to use it, we just pick up the scanner and we just straight away, we can use it whenever we want. So apart from, just having each our own, we can still share it with another practitioner.
In terms of the benefits of having the machine, yes, there's certainly a cost benefit to it, but I think the benefit from having the access to all the things it does is as much of a clinical benefit as anything. For example, I took some study models the other day, and from there we can sort of do digital smile design, right? And before we'd have to pour up models, articulate them, wax them up, all that sort of stuff. So things like that, it just sort of opens up a whole new sort of range of dentistry.
Say you were taking a stand-in impression, sometimes if it went wrong, you'd have to get the patient back. Whereas I find with a scanner, I don't have to get the patient back, and they're relieved because they don't want to be here half the time.
I think patients they'll certainly notice the difference if they've perhaps come from another practice and they've had work done before where they've had to have impressions, or they've sort of said, I don't want to have impressions anymore because they make me gag. They'll say, well, we've actually got a scanner and we don't have to do that. We have very, very minimal sort of problems with adjustments, of insertion. Patients really like that, and they look at the images on the screen and they say, wow, they're really impressed with it.
I think also now the scanner is helpful because there are kids with lots of sensory issues that don't enjoy impressions, the sensation or the flavour. And often when I'm scanning their teeth for, say, a mouth guard, they enjoy watching their teeth on the screen. It's a distraction.
We are very fortunate to have the 4 scanners in the surgery. I can't see myself working without the scanner now. I can't sort of, I don't know what I used to do before. Now you kind of see all the alginate and the messing, now it's not, I can't go backwards.